Let's move on to fertility options for patients with female body parts. Now, there are several more options here because the female anatomy is a little bit more complex, but I will go through a couple on this slide, and then we'll switch over to the next slide and review a couple more. So here we have three options: embryo cryopreservation, oocyte cryopreservation, and ovarian transposition. Embryo cryopreservation is the freezing of an embryo. So this involves removing an oocyte or an egg from a female body and combining it with a sperm outside the body, and then allowing that combined egg and sperm to develop into an embryo and then freezing it. Embryos are usually only around 8 days old when they're frozen. This process has a clinical pregnancy rate of about 50%, a live birth rate of 35 to 41%, and a miscarriage rate of 17 to 22%. So if you look down the list here, it actually has probably the highest numbers for pregnancy success out of all of our fertility options for patients with female body parts. The second option here is oocyte cryopreservation, which is very similar to embryo cryopreservation, except that it does not involve fertilizing the egg outside the body. So instead of going through the process of fertilizing the egg to create an embryo, here we simply freeze the egg by itself. And as you can see, we have slightly lower success rates when we freeze the egg by itself, and that's because they are a little bit less stable as you go through the freezing and thawing process when they are not fertilized. So here we'll have a clinical pregnancy rate of about 35%, a live birth rate of 26 to 32%, and a miscarriage rate of 11%. The third option on this slide is ovarian transposition. This is a surgical procedure for folks who are undergoing radiation, primarily to the pelvis. And essentially what this does is it moves the ovaries out of the way, essentially, of the radiation field so that they are not exposed to radiation. Here we have a clinical pregnancy rate of about 3 to 50%, so highly variable, I think, depending on the surgeon that you work with. You have a live birth rate of about 18 to 55%. Again, we're looking at very dramatically large ranges. And in about 16 to 93%, again, a huge range of individuals, you can have ovarian function preserved. Of the three options on this page, most popular is embryo cryopreservation because it tends to have the most success. Three additional methods for fertility preservation for individuals with female body parts include uterine transposition, hormonal suppression, and ovarian tissue cryopreservation. So uterine transposition is much like ovarian transposition. When you're going to have radiation to the pelvis, this is a surgical procedure to physically move the uterus out of the way of radiation. This is not done very commonly because it is a very specific radiation field for which this is helpful. And the limited data we have in this for this procedure involves a clinical pregnancy rate of about 60%. Hormonal suppression is actually a fairly commonly practiced fertility preservation option where when an individual is about to undergo systemic chemotherapy or systemic treatments, they're treated with a hormonal agent that actually puts their ovaries on pause, essentially. It halts the process of normal ovulation to try and protect any eggs that might be in development from the effects of chemotherapy. With this procedure, again, we have limited data to show that it is helpful. Most of that data is in breast cancer patients. We can see that patients are 60% more likely to maintain their ovarian function than if they are not, if they don't undergo hormonal suppression. The third option on this slide is ovarian tissue cryopreservation. And this option essentially does the same thing as testicular tissue cryopreservation, where a piece of the ovary as an organ is itself surgically removed and frozen. Again, this is a little bit less common because it is more invasive, and it involves a clinical pregnancy rate of about 45%, a live birth rate of 19 to 32%, and a miscarriage rate of 7.5 to 14%.